Okay, hello, so this is Chapter 7, Misuses of Benzodiazepines and Similar Agents. Benzodiazepines, BZs, medical uses. BZs were developed as a safer sedative hypnotic alternative to barbiturates. BZs treat severe disorders, anxiety, insomnia, muscle spasm, and seizures. Between 10 to 15% of adults in the Western world use benzodiazepines at least once yearly. Scope of prescribed BZs use. Approximately 5.2% of adults in the United States use BZ. Usage rates fluctuate between age range. BZs are slowly being phased out in favor of safer anxiolytic drugs that carry less potential risky side effects. Medical uses of BZs. BZs were originally thought to be non-addictive and far safer than barbiturates. BZs have a limited role in treating acute anxiety, and they have effect on long-term general anxiety disorder. SSRIs medications are replacing benzodiazepines for many of these purposes. BZs continue to decline in popularity, especially with new benzodiazepine receptor agonists being developed. Pharmacology of BZs. Various BZs are classified by duration of action and pharmacological characteristics. More lipid-soluble will affect absorption and slower elimination. Allow some choice in which BZs to use depending upon desired effects. Though often compared to barbiturates, the mechanisms of action in more specific of BZs. BZs exert their impact by affecting the GABA system. Subjective effects of BZs at normal levels. Users report reduction in anxiety and gentle relaxation. When used as a hypnotic, BZs reduce sleep latency, which leads to enhanced restful sleep. BZs are involved in 1/3 of prescription drug deaths, and their use in suicide attempts is a concern. Relatively non-toxic, but when combined with other depressants, the margin of safety is greatly reduced. Side effects of BZs at normal levels. Around 10% of patients will experience some degree of sedation, but reduces in a few days. Side effects can include irritation, hostility, aggression, and paradoxical rage. There is a potential for anterograde amnesia or blackouts. Some BZs require extensive biotransformations, leading to a lasting impact of side effects. For example, driving may be impaired for several hours. Neuroadaptation to misuse of and addictions to BZs. Those who misuse BZs fall into one of two groups. One small group that uses BZs to achieve euphoria. Intravenous BZ users often misuse more than one drug at a time. Second, more common group that misuses them by taking more of it and for longer than was prescribed in reaction to development of tolerance. The two groups are not mutually exclusive. Discontinued syndrome indicates the ability of BZs to initiate neuroadaptation to these compounds based on the following factors: duration of use, dose used, half-life of BZ used, individual expectations. BZ misuse. Reason: to enhance the effect of another drug, to control some of the unwanted side effects of the primary drug, to help control the effects of the withdrawal process from the primary drug of abuse. Patients who are recovering from any substance use disorder are at risk for a reactivation of their addiction if they should receive a prescription for benzodiazepines. Drug interactions involving BZs. Cimetidine can increase BZ blood levels. Disulfiram reduces speed of biotransformation. BZ's can alter the blood levels of many antipsychotic medications such as halperenol, St. John's wort plus BZ's may result in increased anxiety. Due to synergetic effects, BZ's should not be mixed with any other CNS depressants. Long-term consequences of chronic BZ use. Although originally hailed as safe and non-addicting, neither assertion was correct. There is potential for psychological dependence, like clock watching for the next dose. Use for long-term anxiety is no longer preferable. BZ is recommended for short-term treatment of insomnia after other approaches have failed. So BZ receptors antagonist, 1 of 6, buspirone, released as Buspar. New class of compounds, azasparins, treat GAD but not panic attacks, and may have some antidepressant effects. Several potential side effects, interactions with MAO inhibitors. Zolpidem, released as Ambien. It causes only a minor reduction in REM sleep. When used at normal levels, does not interfere with normal progression through the stages of sleep. There are several potential adverse side effects. Misuse potential is higher than originally thought, potentially as high as BZ's. Xalapon, released as Sonatate. It is approved in the United States only for hypnotic use. There is little evidence of a hangover effect. There are various side effects. Tolerance to hypnotic effects develop quickly, so only good for a short-term use. Misuse potential is the same as for benzodiazepine. Lunesta. It is not a member of the benzodiazepine family, but it is a hypnotic meant to treat short-term insomnia. It does have an abuse potential. Reported side effects include hangover effect, GI upset, cognitive problems. There have been rare reports of anaphylaxia in some who take it. It is implicated in amnesia with higher doses. There's a synergistic effect with other CNS depressants. Ranelaton, brand name Rosarm, is a level hypnotic agent that binds at the melatonin receptors. It is thought to enhance the effects of melatonin and facilitates the sleep cycle. It can be particularly useful for those with alcohol use disorder. Only 2% reaches the brain. Rohypnol, benzodiazepines that is not legally sold in the United States. It's a Schedule 4 compound used by physicians in other countries as a pre-surgical medication, muscle relaxant, and as a hypnotic. Known in the United States as the date rape drug, as it induces amnesia that can last for up to 24 hours, 10 times as potent as other benzodiazepines. So hard to detect in urine toxicology test. This is the last slide. So sedative, hypnotic, or anxiolytic use disorder. So yeah, that's it for this video. Thank you for listening.